Are you working in psychedelics or taking steps to get involved? Lately, we've been thinking about the future of this field, the people who are going to work with psychedelics, and how they're going to show up. So we decided to ask them. Here's what we heard from people in a new survey who are working in psychedelics right now or preparing to launch their careers. 87.6% have been influenced by their own positive experiences with psychedelics. While 47% are incorporating psychedelics into an existing career, 31.6% are switching careers entirely. And not surprisingly, making money is not the goal. A staggering 98.3% of respondents indicate that making a lot of money is not their primary motivation to enter the field. If you're curious to learn more about this growing space and perhaps find your place in it, we're inviting you to download our new 24-page report, The Emerging Psychedelic Workforce. It's packed with insights on the field you won't find anywhere else, and it's completely free. You can find it in the articles section of our website at psychedelicstoday.com/article titled The Emerging Psychedelic Workforce.
If you're looking for a getaway this winter for rejuvenation and transformation, join Psychedelics Today for our vital retreat at Blue Osa in Costa Rica. Blue Osa is an eco-resort that's all about harmony with nature. It's nestled between the jungle and the beach and primarily runs on solar power. And included in your vital journey are 8 days and 7 nights accommodation, 4 transpersonal breathwork sessions, 2 as a breather and 2 as a sitter, 3 farm-to-table meals per day, and you'll also receive a $50 gift certificate for the on-site Blue Osa spa so you can indulge in some relaxation. Spend your free time taking a dip in the natural pool, exploring miles of secluded jungle beaches, and experience guided birdwatching hikes at sunrise. Stay active with daily yoga, intuitive movement, and CrossFit practices to keep your body and mind in sync. There's also free Wi-Fi if you wish to stay connected. Your group airport transportation is also included, making it a hassle-free adventure. So if you're ready to reconnect with nature, yourself, and other like-minded healers and professionals, join us this January 6th through 13th, 2024. Visit psychedelicstoday.com/events and scroll down to the Costa Rica retreat page for more info.
Hey everyone, David here. I'm sure you've noticed that every passing year, psychedelics are becoming more accepted into mainstream culture, and many people all over the world are asking themselves, how can I get the foundational knowledge and skills to build a meaningful career in psychedelics? Well, that is exactly where Vital comes in. Vital's our 12-month multidisciplinary psychedelic practitioner training program. It's deeply comprehensive, inclusive, and most of all, transformative, both personally and professionally. Our graduates have gone on to do many wonderful things in the psychedelic space, and here are 6 real examples of what some of our alumni did with their Vital experience. Opened up a ketamine therapy clinic, got accepted for a PhD about ayahuasca, built a retreat center, launched an entheogenic church, started their own coaching and wellness practice, and launched a psychedelic media and merchandise platform. So if you are feeling the call to join this movement, you need to apply before December the 20th. Classes start January 23rd. Please head to vitalpsychedelictraining.com to download our full course curriculum, check out our teaching team, and receive your application form. You can also check out our events page at psychedelicstoday.com to sign up for an upcoming Vital Q&A session or join an expert-led topical taster webinar. Find out whether Vital is the transformative journey that you've been looking for.
Dr. Bessel van Kolk, welcome to Psychedelics Today. It's such an honor and pleasure to have you on the show today. Thanks for being here.
Pleasure to be here.
Yeah. I mean, your work has been so inspirational, I think, for so many people. I was actually just talking to a friend asking them if they read the book, and they're not really in the realm of psychology or whatnot. So, I mean, you've contributed so much to mind-body and somatics. I think most people know who you are, but for those, might be their first time. Could you do a little quick introduction?
Well, I'm a psychiatrist, and I've been around for quite a long time. I was part of a much larger team of people who put the PTSD diagnosis together originally in 1980. and I've been studying. I think what's unique about me is that I've always had a very serious clinical practice where I actually treat very traumatized people, and I've run a laboratory actually as of until tomorrow when we're closing down our laboratory for the first.
Oh, whoa, closing.
But I ran a psychedelic lab for the last 10 years, and I've done research on yoga, EMDR, neurofeedback, neuroimaging, all kinds of different things having to do with trauma. Yeah.
Amazing. Thank you. Thank you. I would love to maybe start off and define trauma. I know this is kind of a newer thing within the past few decades. So when you started off with your research, like how did you view and define trauma, and how has the field really evolved over the past few decades?
Well, when we started off, there was no attention being paid to trauma. So it's very clear what trauma is, namely having an experience that's totally emotionally overwhelming, that leaves you helpless and bereft, basically. This, like last week I did a podcast and my host was caught in the rain. He was 5 minutes later. I said, I had my own trauma. I said, no, being late because of the rain is inconvenient.
Right.
And all these journalists say, oh, the pandemic was his national trauma. No, it was an unfortunate experience, but that's not a trauma. For some people it was, but it's really about something that leaves you absolutely paralyzed in a helpless stage of rage and terror, actually. Yeah.
Awesome. And how has, I guess, trauma treatment evolved over the years?
Well, it evolved. There were actually three different angles. One is, it started off when the world was still a psychedelic world, so people dealt with it by talking about it and telling the truth and being a witness to what happened to people. And sort of Judy Herman's original contribution was really to nail that down. Then some other people came from a more cognitive angle and they developed CBT, which I've never been much of a fan of.
Me either.
And then, of course, neuroscience came on, and I was sort of part of that world also. And so people started to look at what happens in the brain and whether we can give medications or change brain circuits in a way that people can become more focused and calmer. I would say the holotropic breathwork, which I have not done, but it's an important part of the psychedelic background. I would call that in the third category. How do you change the state of the organism, basically?
Yeah. Well, I guess that's a good shift, and I would love to hear maybe a little bit about your background with psychedelics and how did you start getting more involved in this? Like when I found out you were part of the MAPS space area, I was like, oh, that's interesting. I wonder how you were kind of, you made that transition. I don't know too much about your background in psychedelics.
Quite a long time. I'm a geezer, so I had Timothy Leary's old office at Harvard at some point. I belong to the generation of the 60s, and so almost everybody I knew took psychedelic substances back then. And it was really quite an eye-opening experience. And also today, I have quite a few friends who are sort of major scientists, and I asked my friends, so did you take acid also in college? And all my friends say, yes, I did. And I say, so how do you think it affected you? And my friends generally say, well, I think it really accounts for my having become a good scientist, because I got to appreciate that the reality that I hold inside of myself is just a small fragment of the overall reality that there is. And so I think the psychedelic world opens up and it makes you sort of into a modest person. And that you know that the mysteries of the universe are so much larger than you are, and it gets you away from these simplistic models of that causes that, and these linear ideas. Because what psychedelics really confront us with is the non-linearity of things. And it fits in very well with one of my early pieces of research. We did a first neuroimaging study on what people go through when they have a flashback, a reliving of their trauma. You couldn't do that study today anymore. No institutional review board would allow you to basically torture people in a scanner, so by having them relive it. But we did that sort of innocently, not realizing at that point how horrifying it would be to be in a scanner while they relive their rape. But what we learned there is that what gets activated in the brain is some very primitive areas having to do with survival and housekeeping of the body, as Antonio Damasio calls it, and that you really have these very profound changes in people's physiology. And so the question really is, how do you calm that organism down? How do you help that organism to be in the present again?
Yeah. Interesting. So, yeah, I guess where was your transition to get more involved in psychedelics?
I became as a college student, I did stuff. I was part of the last little piece of research looking at marijuana and group processes when these things still got funded as a young person at the time. And then the interest sort of waned and disappeared until one day Rick Doblin and Michael Mithoefer came to visit me and said, we are thinking about using MDMA for PTSD treatment. What do you think of that? And I said, I think it's a terrific idea because psychedelics can really open up your mind to new possibilities. But I also discouraged them from doing it because I'd met all these old psychedelic researchers, all of whose careers were ruined. For example, in medical school, my last rotation was on the drug abuse rotation run by Chuck Schuster, and he became Nixon's health czar.
Mm.
And I used to smoke dope with Schuster as a medical student. And then he becomes the big shot in Washington. And he says, these drugs damage your brain. I go, hey, come on, man. That's that's not true. But the whole politics took over, and it became such a sordid issue that it couldn't be studied anymore. And it was really a very very nasty time. So I really gave up on psychedelics for a while, but then very much inspired by Rick Doblin and Michael Mithoefer, they opened up my mind again, and they asked me to become the principal investigator for the Boston arm of this part study, and I eagerly accepted that job. Yeah,
That's amazing. And how's that been for you?
it's been a marvelous experience actually. I'm really at the end of my career at this point, and I really see it as a capstone. We're actually submitting our last paper today
Oh, amazing.
on our
Congrats.
MDMA study, and what we found was really quite remarkable actually. And that is that in the research world, people measure these DSM diagnoses, but these DSM diagnoses have no scientific validity whatsoever. So we're studying sort of fictitious disorders, including PTSD in and of itself. Yes, it exists, but it's all more complicated than what we think it is. And it was really very gratifying for me to be part of the psychedelic team the past 10 years or so, where we got to see the astounding transformations that people go through on psychedelics, more than anything else that I've seen in my career. And I've studied many different methods, and I've studied other things that also turned out to be quite helpful, like EMDR and internal family systems therapy and theater and yoga. But the transformations on psychedelics were really astonishing and made me really hopeful that we may enter a much more complex era of thinking about mental functioning.
Mm. And how so? Do you feel like psychedelics are really kind of informing us how the mind works or how mental illnesses
I
and
think
how
it's
we
going to
define
bring,
that?
yeah, I think it's going to bring the mind back into our field. We became psychiatry became a mindless discipline. Like, here's your pill, here's your pill, here's your pill.
Yeah.
And I did the first studies on Prozac in Zoloft, and was happy to do the studies, and it helped people a little bit, but it clearly was not satisfying. It didn't really help people enough. So 40 years ago, I moved on from Prozac and Zoloft, but my profession unfortunately didn't, and the mind disappeared. And what has always been very central to my thinking and my work is that trauma at the different ages, different developmental stages, has a very different impact on how you process it. And so the whole issue of how does the mind work, you're too young to have grandchildren, but I hope someday you'll have it, because grandchildren are just fascinating. When they're your own kids, you don't see it, but when they're not your own kids, you can just be the benign grandfather, you see how every week you deal with a different person, and that the mind continuously evolves, and that they grasp ever increasing areas of complexity. And one of the earliest things that I really came to believe was that Pierre Janet, who was the first person who ever wrote about trauma in the 1880s, well before Freud actually, said that when you're traumatized, you get stuck at the level of mental development at which the trauma occurs to some degree. And I thought that was a very accurate observation, but these mental processes, how people process information, have not been studied in a serious way in the last 40 years. And that's what we should study.
I heard you talk, I think it was on one of the Esalen podcasts, and you said nobody is studying mind anymore. And then I think about, I was at a conference a number of years ago with Dr. Dan Siegel, and that was something that he brought up too. He's like, in my entire training, I don't even know how to define mind. We didn't talk about it. We talked about the brain. So I would love to hear a little bit, how do you define, what is mind? How do we define that?
Our mind is how we process information. Here, I'm looking at the screen of my computer at some face of some guy I've never met before. And yet my mind transforms and experiences you're a human being, and I assume that you know certain things, and we speak the same language, and I assume that we have a similar cultural frame. So we have, our mind is a symbolic mind. Actually, one of my feeds this morning was from the Neuroscience Journal that says that why do people think in terms of symbols? I think, yes, that's what we do. So I'm really eager to read that article. And that's, we're symbolic creatures. And so you hear a particular piece of music and you start crying, and you hear the other piece of music and it doesn't do anything for you. And that's how you happen to process those sounds and make meaning out of them. So our mind is how we make meaning out of things. And when you're a little baby, there's very little meaning, but by the time you're 8, 9, and when you're an adolescent, everything means something to you. So it becomes larger. And I think psychedelics have they're truly mind-expanding agents, and they can really help you to grasp things that you didn't grasp before, to get introduced to realities that you were not aware of, to integrate new possibilities, and not to get stuck. And of course, being traumatized means that you get stuck.
Yeah, stuck, kind of frozen. So I think when people typically think about the mind, they think about the brain. I think it was Wilder Penfield that says, mind lies beyond the brain. And I'm wondering, what do you think about that?
Well, no, I think Penfield the excitement, of course, is that Penfield is really the person, one of the people who started this, is that, yes, the brain actually contains mental processes, and he's beautifully studied that. And then the excitement initially was, once we understand the brain, we can understand mental processes. And then the focus became on brain circuits, etc., and brain organization. But the processes that underlied it, that gave rise to it, got ignored in a way. So the neuroscience piece has been exciting, and it continues to be an exciting way of looking at things. But after the Webb telescope came out, I now show pictures of how Galileo saw the universe versus how the Webb telescope sees the universe. And I like to say, we are sort of where Galileo was back then. And our technology cannot grasp the complexity of mental phenomena. It's exciting, it's interesting, but I wish we would pay more attention. And what's also interesting in my world that if you talk about how you make sense out of things and how you focus and concentrate, you're doing soft stuff. But once you have a brain image of it, you're a real scientist. And right now,
Right.
the only real science, what people think is science, is brain images. Of course, that's nonsense.
I mean, how could you validate maybe quote unquote those softer fields of study? And
Well,
it's interesting to kind of critique neuroscience, right? Because that it seems like the gold standard, especially when it comes to psychedelic research, is like what's going on in the brain. So how could we validate maybe these other fields? Like I
oh,
think about transpersonal psychology or some of these other fields where
well,
we're
you know, for me, aside from doing this early neuroimaging studies, uh, my most exciting studies I've done in some ways were my studies of the Rorschach.
mm,
And I would love to bring the Rorschach back into the world. It's become a completely forgotten way of doing things, and people poo-poo it. But if I show you some nonsense inkblot, your mind is going to make sense out of it. And what we found is that when people have PTSD, uh, their mind worked completely different than other people. And then when actually I did pre-post Rorschach's giving people Prozac, I was the first person to study Prozac, and I saw that Prozac was able to change mental processing dramatically. And I never published that paper because life gets busy and you have some data you don't put in a journal. And I really regret not having done that because it might have kept the field alive in terms of mental processes. Yeah.
fascinating. Do you think there could be a shift in psychiatry and psychology to get back to studying this? Or do you think the kind of medicalization and just focusing on the neuroscience is just so hard and
Well,
that's where it's at?
when you're involved in psychedelics, it's inevitable that you get to get involved in mental processes. But right now, for example, I'm working. MAPS is sort of the pharma people have become much more prominent in MAPS, and they talk about Prozac.
Right.
The mind again is disappearing, but it's inevitable that the mind will. We have to. It's so obvious when you give people psychedelics how their mindset changes. And psychedelics, you don't take psychedelics to change your DSM diagnosis. You take psychedelics in order to expand your consciousness. And it's not to give you behavioral health, so you're less a pain in the ass to other people. Uh, you take psychedelics in order to expand your consciousness and open your heart.
Yeah. Well, that's an interesting comment. And it makes me think, critiquing the DSM, what is a mental illness from that perspective? And then thinking about the medicalization of psychedelics. I had a teacher that said, psychedelics, I mean, the clinical kind of application is going to be a very kind of small role to some degree. But once you start kind of getting into more kind of, I guess, like, spiritual philosophical discussions, opening your mind, maybe seeing the world in a different way, we're not just talking about behavioral changes,
Yeah.
and we need to treat this thing. Yeah, just kind of wondering any thoughts that are coming up for you around that.
Yeah, I don't think I have anything else. Now, look, I was part of the DSM-3, DSM-4, not the DSM-5 anymore, because I sort of had a different role there. And we needed to have some sort of framework to do drug research. And that's why the DSM was created, to see if you could get a certain conglomeration of surface phenomena if a particular drug would be helpful for that. It was a very primitive way of doing things. And actually, the preamble to DSM-3 said this is just a list of symptoms. They have no scientific validity, and they should never be used for forensic or insurance purposes.
Hmm.
And that preamble got left out
And that
subsequently,
just, yeah.
and now people believe that these things actually exist. They don't. They're certain. They capture certain surface phenomena, but what causes it? There's certainly no um, uniform origin story to bipolar illness or schizoaffective illness or ADHD. There's certain surface phenomena that may have very different underlying biological factors.
Yeah. Important. I mean, this is important, right? And I think a lot of people kind of butt up against it, and it is kind of a challenge to, I guess, kind of look at other perspectives when it comes to kind of mental health and mental illness.
I'm surprised how many mental health professionals and physicians actually don't question this.
Yeah.
Even though it stares you in the face every day if you see people that like, no, kind of these diagnostic categories don't capture what goes on with this human being.
Yeah.
And what's sad for me when we do the psychedelic research on MDMA, the outcome measure was PTSD, the primary outcome measure. But I don't think that's what we treat with psychedelics. You
Right.
treat mental rigidity and getting stuck, and indeed the PTSD improves. But the paper that I hope to finally goes out today for its final publication shows that it changes your relationship to yourself and to your relationship to other people, that you become more tolerant of other people's point of view. You are able to negotiate differences of opinion better. You're able to articulate more clearly what your own emotional states are like and more appreciative of other people's emotional states. So it goes way beyond. So what is ironic is that when I joined the study, I was asked to be in charge of the so-called secondary data. The primary data was PTSD, secondary was self-compassion and self-regulation and ability to understand other people. To my mind, those are not the secondary data. Those are the primary data. Who are you, and how does it change who you are?
Yeah, that's really important. I think that's maybe what I was kind of getting at from like just looking at it from the medicalization, where it's like you need to meet a diagnosis criteria and you're treating, that mental health illness versus, there's deeper parts of ourselves that start to emerge. And we go, oh, this is maybe how it's interfacing, or, these different parts are showing up, and maybe this is why I'm like this, or this is how I'm relating to people. I mean, when you're talking about the relational piece, I think about attachment. I think a little bit about that polyvagal theory around relationship is really where the
that's also, but polyvagal theory is just like talking hippocampal theory or medial prefrontal. That had a polyvagal system, very important, tiny little part of the brain, but it doesn't explain the whole complexity of minds. It is just again focusing on one little detail and thinking, oh, we have found the answer. No, it's a little piece of a gigantic puzzle. Webb telescope, like no, the little dot over there doesn't explain the universe.
Yeah. So something that kept coming up, thinking about when you were talking about scientists using this, and then thinking about, say, clinical applications. I mean, there's a much wider use of psychedelics and potential here, and not just sticking it within kind of like this medicalization. And wondering, like, what other potentials do you see with psychedelics outside of the mental health?
Begin there. That one reaction I had to what you were saying a few minutes ago is that once people start defining themselves according to what the charts say about them, they're done for. Well, people who come into your office say, I have PTSD, and that becomes their identity. Or I have bipolar illness, that becomes their identity. And once you buy into that system, you're stuck. So that's who I am. And people generally don't come and see me in my practice because I am that. Although what we showed in our MDMA research is that after the psychedelic experience, people's identification with that trauma became much less. And so people, before they'd say, I'm an incest survivor. And then afterwards, people would say, oh, I'm a school teacher. And I've had some struggle with getting close to people. I've been scared. And I guess that's because of my incest. But now I've joined the choir and I'm singing with people and I'm actually dating people. And so the identity opens up to wider possibilities. And that's what psychedelics is about, actually, is to open up people's world to new possibilities.
Yeah. Yeah, and I'm just thinking about some of my own experiences, like working with some of my traumatic experiences in psychedelics, and that relationship changes, and I
Yeah,
start to not identify with that anymore. It's like something that
right.
happened to me, something I can like make meaning out of all of a sudden, and then it changed. But it is really hard, right? When people really attach to a label, and then that creates their
Yeah,
identity, and it's really hard to break from that because all of a sudden that's who you are. And so it's like we need a tool to kind of step outside and go, well, what
right.
other parts of ourselves, like who am I? How do I identify without that?
And so I'm really curious, for example, there are now uh, finally some studies going on at the VA with veterans. Uh, there's only 2 sessions. So, and when I did my psychopharm research many years ago, what I found is that once people have an identity of being a disabled veteran, they didn't budge anymore. And so once you have been identified as a Vietnam veteran, let's say, I really wonder how, if 40 years later, you can really completely refigure that identity and say, oh, yeah, I've spent my whole life as a veteran, but boy, I didn't see what else there is in the world. You know, I missed out on other things. So I'm very curious how it will play itself out, because giving up that identity is a hard thing to do. It's a little bit like the Shawshank Redemption, right? Morgan Freeman, who has been in
Yeah.
prison all his life, he doesn't know who he is when he's not in prison anymore.
It's a really hard thing to do.
Yeah,
I've been exploring that a little bit too, like just kind of getting in touch with other parts of myself that maybe I've
yeah,
completely neglected over the years because certain parts needed to kind of shift in, focus
yeah,
on, things in my life. And I'm like, oh, I forgot I love bike riding, right? It's
yeah.
like I totally just pushed that away. And I'm like, oh, wait, no, there's like a very active part of me that I just totally neglected because of either academic work or life. And I'm like, oh, wait, no, this is part of me. And it's trying to bring that back in a little bit more, which is,
Yeah.
it's interesting. But it's hard to shift away from, who you think you are at times.
Yeah, and it also demonstrates again how you need more than just the psychedelic experience. You also need to start hanging out with people, and I hope you do that in your training. We do it to some degree in our training, where, for example, my favorite clinical activity is psychodrama, where
Mm,
people sort of set up alternative realities by moving together and playing different roles with each other. And we just showed a movie at this psychedelic conference in Denver, where we combined ketamine with psychedelic experiences. And it was a very profound experience that people actually did other things besides taking psychedelics in order to bring things in at that point. So
mm.
when you're traumatized, it's very hard to take in new information or new experiences. Once you're on psychedelics, you become wide open to take in new possibilities. And so I think that's why set and setting is so terribly important with psychedelics, that you need to be in an environment where new stuff can come in that's benign. And if the environment is not benign and not caring, you actually, that lack of caring might also be coming inside it. Psychedelics make you wide open to take in what happens to you. And I think what you do at that particular point is terribly important. And that's really what my wife and I, uh, and our foundation, Tom Research Foundation, is very much trying to pay attention to what can we help to bring into people when they're in these open-minded states.
Yeah, that's a really interesting thing to think about. Like, yeah, what adjuncts can you add on to psychedelic therapies? Because the psychedelic is just one part of it. And I wonder if you could define psychodrama a little bit if people don't know what that term is, or
Well,
what a practice looks like.
I, I do a particular form of psychodrama that I learned from El Peso, who unfortunately called it after himself. So he calls it Peso Board in Psychotherapy, which is just 10 people in the world practice it like that. It's very tiny. Uh, but it's very precise. You invite people to very carefully and gradually put the people of your past into a room. They play roles, people. Then the feelings about these people come up, and you work really in three-dimensional space. And that's another, for me, fascinating thing, is that once you work in three dimensions in space, emotions become much more vivid. You become much more aware of things, which fits in with our original neuroscience research that showed that the imprint of trauma is mainly in the right side of the brain, which is not a logical, but it's a spatial part of your brain. So once you use space, it becomes important. And so you sort of lay out your past, you see it out there, and somebody plays the role of your dad, and all the feelings about your father come up, uh, angry or loving or missing, etc., etc. And then you create ideal characters who say, if I'd been your ideal father back then, I would have done this with you. And you actually have that experience of uh, truly reparative experiences where, oh, if I'd been your ideal dad when you were 3 years old, I would have held you like this, or I would have protected you. And people are, oh my God, if that had happened, if you had been there for me back then, my life would have been completely different. And so it's also it's very much like psychedelics. It's really a mind-opening experience. And what we found, we haven't done the research yet, and I don't think I will do it. I hope somebody else will. Is that by having these experiences on psychedelics, you really it helps you to develop a new frame of mind in a way. Yeah.
Yeah, it's fascinating. As you're just talking about that one example, I don't know if you've kind of heard this term, like the golden shadow. It's more of a kind of
No, I haven't heard that. But no.
neo-Jungian
Oh, yeah.
thing. We're going to probably be talking a little bit more about it at Psychedelics today as the months go on. But as you're talking about that, I really think about, here's somebody that maybe, grew up in a neglected environment, right? Didn't get what they needed from their father. And that golden shadow piece is like being able to accept that and creating an environment where maybe you are receiving that, like having somebody else play that. And because that could be really hard for folks, right? To accept love, to accept like celebration, and to feel that and maybe get that part met. I think that's really interesting.
That's the idea. Yeah, that's the idea. And of course, in traditional therapy, uh, most therapists I would know would believe that my relationship with this person gives them a reparative experience. And what Bessel taught me was, no, it doesn't work that way. It's the wrong person at the wrong time at the wrong place. I, as an 80-year-old guy, cannot give you the feeling of how your mom could have loved you when you were 3 years old. It's a mismatch.
Right.
But in psychodrama, you can create structures in which that becomes real, and that I don't become my warmth and love for you is not the change agent. It is the situation we set up for you, with you, that becomes the change agent. So it doesn't depend on my benignness or that I give you what your mom didn't give you. No, we create that independently of me. So you carry it with you for yourself.
Interesting. And could that be done in groups?
Oh, you always do it in groups. Yeah.
Always do in groups. Okay,
Yeah.
cool. So
There's some people who may be able to do it individually. I can't. I can only do psychodrama in a group.
Right. Well, that makes sense, because again, you could probably pull in from different personalities.
Exactly. You
And
need different
different
people in the room.
roles.
You need different bodies in the room.
Yeah.
Yeah.
Oh, fascinating. I love this. And I guess on this topic, thinking about like different things to incorporate, have you thought about, I guess, like, you're part of the MDMA research. How's that protocol working out? And then also thinking about like evolution of psychedelic therapy protocols, like, you're incorporating a lot of different somatic techniques, dosing, do we do a full on like macro dose versus more psycholytic dosing with somatic therapy? Like, have you been thinking about this a lot?
Oh, I think about it a lot, actually. For example, I think the MAPS protocol is a beautiful protocol. It is unbelievably expensive
Yeah.
and completely impractical. Vic Doblin raised a huge amount of money, and so our therapist got paid well for being in the study. That never happened to me before. When my postdocs did things, we never paid them for it. Now people got paid. There's 2 therapists, 8 hours at a time, total of at least 36 hours of therapy with 2 therapists. Nobody can afford that.
Yeah.
And so the model is beautiful, but impractical. And the trainings that I'm part of, I work with Phil Wolfson and other people,
Oh, awesome.
and we do ketamine-assisted psychotherapy trainings. And I think I love that model actually. People come in, and it's about 30 people in the class, and you work with each other.
Mm.
You sit for each other. It's a group process, and we create a very safe environment, and we're very careful. Very, very few side effects. Doesn't always work, but most of the time it does. And then the person over there may have a horrendous experience and feel all that pain. And the person next to them goes like, "Oh my God, I saw love and beauty and eternity." And so you get all these different things in a room. So if you happen to be the person who goes through very painful experiences, which I've had on psychedelics myself also, uh, you get sort of comforted. Oh, I'm just part of a larger universe, and I happen to today carry the pain, but it doesn't mean that that's all that there is to me, because tomorrow I may see God just like the person next to me, and vice versa. So I think the group model is a very nice model actually, and it would be financially quite feasible actually. Yeah.
Yeah. And you said you're doing kind of like this journey or sitter pair. So that's kind of like how the breathwork model operates too. It's more
Yeah,
of
that's
like this communal group thing. You have the breather sitter.
right.
And it makes it more accessible to some
Accessible, and
degree.
also you really see yourself as perspective.
Yeah.
No, like, everybody's there. People become very open with each other, and you get to see that some people go through very deep suffering. You say, "Yeah, we go through very deep suffering." Other people go through beautiful mystical experiences. Yeah, that's also part of life, and you really get to have an appreciation of you are part of all of these experiences.
Yeah, right. Like I think the individual model is like everybody just kind of goes internal and
Right.
they might have a facilitator that helps to guide them in a way. But this model, I feel like I guess bringing it back to the relational aspect, it's like I think some people get worried about like, oh, I have to sit for somebody or I have to be there, but you also don't understand if you haven't been in that role, like how much you actually may receive.
Yeah,
Like the
I
heal.
live in the world of therapists, so saying I don't want to be responsible for somebody is not a common thing in
Yeah,
my world. I mean, we become therapists because we sort of
right,
enjoy
right,
being there for other people. Um, and of course, that's what life is all about. We are like we are monkeys with a big forebrain, like uh, we are
yeah,
communal creatures. That's what we have brains for. And this whole individualistic notion, the John Wayne notion, is a pure cultural artifact. No culture in the world ever created John Waynes who can
right,
be
right.
also self-sufficient, because that's not who we are.
Yeah, yeah. So on this topic of like more group models, I don't know how much you've been following kind of the decriminalization movements, what's happening in Oregon and Colorado, and just kind of think your thoughts around that, because the
Oh yeah.
Oregon model kind of exists outside of the medical model.
Uh,
And
so I was at a psychedelic conference, but I got COVID during the psychedelic
oh
conference.
no,
I missed most of the other presentations, sadly. Uh, but so I don't quite know what's happening. You probably know more than I do.
yeah, yeah.
I hear rumors, and I'm part of networks of people who talk to each other, but I have no idea what the big world looks like.
Right, right. Well, looking at Oregon, they passed this adult use model, and it's kind of outside the clinical model, right? So you don't need a diagnosis to receive services.
Right.
I think Colorado, something similar is happening. I think they will have kind of treatment within some sort of medical model, but they've also have like a decrim bill, and so I think they built in a little bit of a community model where people can come together and do community healing. And I know there's a lot of different opinions, especially those that come from professional fields, saying like it kind of needs to exist within this clinical model. And then, people are already doing a lot of this stuff in community already.
That's right.
Yeah.
Some people said to me, like, you're all involved in legalization of this stuff. Don't worry about it. Doesn't matter if it's legal or not, because we're going to continue
People are
to do
doing.
it no matter what. Yeah.
Yeah. So I think that helps with the accessibility piece, right? People coming together. I mean, I think the risk of that is people not having appropriate training, abuse, and kind of just things happen, right? People get harmed in a way, not
Yeah,
having
yeah.
adequate training. But
And it's a very complex issue, of course, and that is that professional training does not necessarily make you a good therapist.
right,
Going to medical school doesn't make you a more compassionate person. You know, in fact, research shows it's the opposite. Okay. And so, who are the right people is a big question always. You don't learn how to become a attuned, um, boundaried, careful, and thoughtful person in your professional schools in the way. You learn that from your own therapeutic experiences and going through therapy yourself and uh, having people who amplify those features in you. But that's not part
yeah.
of your professional training at all, of course.
Yeah. Well, I guess on that topic, thinking about a psychedelic experience for those that want to get into it, how crucial is that? And is it an important part of the training process? I know, again, there's two sides to
It's
this.
very hard. Uh,
Yeah.
you have to have standards, and the question is, how do you set the standards? Is a very tricky question. And we all know uh, very experienced, well-known mental health professionals who are not compassionate and who are not open-minded. So how do you do that quality control? It's a really tough one, actually. Yeah,
Yeah. What qualities do you think a psychedelic guide, facilitator, therapist should have?
I think the most important thing is your own self-experience, to really have gone through it and plunge the depth of your own mind and being, and to know the pain that dwells inside of you, and to know the joy that lives inside of you, and to really uh, experience yourself as the complex person that we all are. uh, I think that's the number one requirement. And of course, a lot of people don't do that anymore as a requirement to become a mental health professional. Um, but we are, and it fits in with the earlier question you asked. My wife is a body worker, and we are
Mm,
actually this week finishing another, hopefully this week, but very soon, our new book called Come to Your Senses. And it's about somatic awareness and body self awareness, actually, which is what we're focusing on. And what struck us in our psychedelic trainings that we're part of is that some people required enormously high doses before they would feel anything. And uh, my wife, the body worker, said, that's because they're out of touch with their bodies. And so, as long as you shut down, as neuroscientists say, that insula, that part of your brain that puts you in touch with your body, and if you have learned to shut it down, then it's very hard for anything new to come in. So, as part of our psychedelic training these days, we spend at least 2 days on somatic self-awareness, and then the doses of drugs that people need to take after that decreases very dramatically
mm,
because you become much more sensitive to yourself.
right. Could you define what somatic awareness looks like, or what some practices may look
Well,
like?
it is very much like, I'm sure, what you went through with your holotropic breath work, with I have never done. Your meditative work, you really feel what it feels like to feel your hand on your heart, and to what happens when you take a deep breath, and what happens when your body gets close to another person's body, what happens when you get touched in particular areas of your body, what happens inside of you, and to really become aware of that creature who you are. To really uh, part of uh, my book is called The Body Keeps the Score. And people say, well, the body doesn't remember anything. I said, no, my book is not the body remembers. The body keeps the score. It's expressed in somatic sensations generated by the brain. And so if you're very traumatized, you try to shut down those feelings of panic in your chest and that heartbreak and the gut wrench. And so you learn to numb yourself out. And once you numb yourself out, you have no access to yourself anymore. So, a very important part of healing from trauma is to feel free to experience yourself again, to know your somatic experience. And so, in our trainings these days, we My wife's name is Lisa Sky, by the way, and because she's getting quite a reputation for being able to do that extremely well, actually. Yeah.
I think it's so important from my own experience, like just thinking about psychedelics early on, not having any sort of body awareness and having a physical trauma that happened to me early on in my life, disconnecting from it. And then actually that's what, breath work brought to me. It brought me more somatic awareness and allowed me to go deeper into my experiences, because it's like, oh, wait, I can feel these feelings. Like I can learn how to express them in different ways, because our somatic literacy is a little off. I know with like some of my clients in the past, just doing like some body awareness, like what do you feel in your body? And most people are like, nothing. And you're like, well, there's something going on, right? Whether you can feel your heart pumping, you feel a little bit of a buzz. And so like being able to develop some of that language and recognize it and work with it, I think is
and,
really important.
and there's nothing simple about it. So that, I'm quite experienced, but, I worked with Pat Ogden and Peter Levine and my wife and other people, and they really are extraordinarily good in helping people to get into their bodies. And even though I've done this for a long time and I wrote the book on the subject, I'm not as good as some other people are in really helping people to meet their bodies, meet themselves. That takes an enormous amount of skill also. And at this point in the world we live in, there's not much training in that. It's very hard to learn how to be a good somatic person.
Yeah. So you brought up that your wife's a body worker. Have you guys explored body work with psychedelics or post psychedelic experience with body work?
Well, not per se, but indeed that's what we do in our training. And by now, the ketamine-assisted psychotherapy training has a large somatic component to it, largely taught by Lisha, where people really get to feel their bodies much more. But we have not looked at it as an outcome thing. And my research days as of tomorrow are over, actually.
Oh, well, I'm sure that's exciting, but also sad.
Yeah, but there's life cycles, and
yeah, exactly. On to something new and maybe more exciting.
at some point, you just don't have the energy that it takes to work 16-hour days.
I can't imagine. Yeah, you must be extremely, extremely busy. Bodywork is kind of one component of our breathwork technique, and I found it to be pretty interesting to, think that you're resolved in a session and then do a little kind of focused bodywork and bring it up. And I actually had an experience. I had a ketamine-assisted psychotherapy session, and then the person also had a body worker in the office with them. So I scheduled a massage after. Different type of body work than what we would do in breath work. But I found myself actually going a lot deeper into my experience post therapy session, and went much deeper once like the medicine was wearing off and doing the body work, which I find to be pretty interesting for some sort of like resolution, right, of everything that we're storing in there.
I think it's a sorely neglected piece of our work. Huh? For example, I've been exploring different treatments for my whole life, both for myself and for the people I work with. And one of the most profound experiences I had is getting rolfed. Rolfing is this very, very super deep tissue massage. And if I would have to rank all the things that have been helpful to me, I would say maybe rolfing may have been as important as anything, because I grew up at the end of the Second World War. I was a very sickly child. Many kids of my generation died at this point. There was mass starvation going on. And I was a very sickly, asthmatic kid. And I sure held it in my body. And rolfing, I think, really opened up my body to stop being the body of a very sickly child, basically. And I think it had a very profound experience on me. Had nothing cognitive about it. It was just somebody helped my body to not get stuck in that frozen posture. It's a very rich world we live in, with so many different dimensions, and we oftentimes miss a lot of dimensions.
Yeah. That's interesting. And as you're speaking about that, I think I heard you talk about some of the psychodrama in a podcast I was listening to. But just that expression, when people get really rigid, to be able to bring in new movements and to express
Absolutely.
differently, because you don't realize you might be really just rigid and stuck and you're tensing all the time.
No, and that's why touch is also so important. That if you're all frozen, somebody holding you so you can relax in that is unbelievably helpful. But learning how to touch is another 5 years of training.
I was going to say a little bit of a controversial topic, especially
that's
for
not for amateurs,
clinicians,
you know?
right?
Like,
Yeah. Yeah, we don't receive any of that. And it's an interesting thing because it's like, you're just taught not to do any of that in practice.
right.
But it's like if we're not talking about it, and getting some sort of training. Yeah, I don't know. It's a very delicate thing. Like, should it be
It's delicate,
included?
but it's also, we keep running away from it. But the reality is that if you really feel upset, getting a hug from somebody who loves you makes all the difference in the world, of course. That's still our primary way in which we feel calm. And touched by other people may also scare the shit out of you
Yeah.
and send you into a tailspin. And so doing that right is very delicate and fraught with danger.
Yeah. Yeah.
But that doesn't mean we can just keep running away from it.
Right. Yeah. I think we need to have conversations about it and learn how to do it appropriately. Because are there times that, like, not offering somebody a handheld or, say, like a hug or a hand on their shoulder, could that actually, bring up maybe more trauma or some sort of activation of like, I didn't get this when I was a kid and I really need it during this session, and then you denied it, right?
Yeah. Yeah. No, it's a dimension that we need to really address. Part of what's great about the MAPS protocol, for example, or the ketamine trainings that we do in the MAPS protocol, you videotape everything, so it's all there to see. And I think videotaping is terribly important. And the CAPS training, everybody's there, everybody sees what everybody else is doing. And so there's much more transparency than there might be otherwise.
Yeah, and that's like probably the one benefit of the group, right? And having sitters around, people are like witnessing and observing what's going on. But yeah, it's a delicate conversation, and I know, especially in the past years, since there's some publications around abuse happening, I think people have like shied away from it. But it's also a conversation I think we need to be having because it's happening. And how do you train people in ethical touch?
Yeah, and I think what happened was that New York article. I vaguely knew the people who were violating those boundaries very badly, and it was a terrible thing that happened, and completely unacceptable. But it really shows how important it is to actually do it right, and to not run away from it either. But it's very delicate because it's very. I haven't had that experience myself of people I work with who got sexually aroused and wanted to have sex, but I could imagine if that happens, you need a lot of help to really handle that properly. Yeah.
Yeah. And I always come back to when it does come to this topic, I think it might have been Dick Schwartz or somebody else, that WAIT acronym, like, why am I touching? Why am I, talking? And I think that's part of the issue.
Sounds more like Dan Siegel to me.
What was that?
That sounds more like Dan Siegel because Dan loves these abbreviations.
Yeah, it might have been Dan Siegel. I don't know. It's floating around. I have no idea where it originated from. But I've definitely been in like sessions where there's body work done for breath work, and somebody wants to do body work, and I don't want it, right? But so it really comes back to the agenda of the person, and how do you be more supportive versus trying to do something to somebody, which I think is important. Well, I see that we're kind of coming up on time here. I know we'd have a hard stop. What's exciting you about the psychedelic field? Are there anything, these conversations?
Little things like that will bring the mind back into our field, that we can truly expand our minds, that we can access. Like here's an example. Did you see this ayahuasca movie, Shock and Awe?
I think I've seen it years ago.
Astonishing. I mean, I know trauma. I know what traumatized people look like. It's a prospective study, and they show these movies about these Vietnam veterans, And, I'm experienced. I know a lot of different methods. I see these guys in the movie. I got nothing I know could help these guys. They're just on the other side. They're gone over, I'd say, hopeless. They do ayahuasca and they come to life. You go like, wow. Huh? Like and I've done this work for 50 years. I know a lot of different methods. And I thought, no, nothing I know can help these guys. And they do ayahuasca and they wake up. It's like, wow. Huh? It's awesome what they can do. So the other side, of course, I'm very worried about the legalization of it all.
Yeah.
Because can people handle Pandora's box? And can people handle legal psychedelics? The track record with LSD and ecstasy wasn't so great as long as it was legal. And so, how well are human beings able to handle these substances? And already in Greek and Hebrew mythology, they talked for thousands of years that no human beings cannot do this.
Right.
And so there's a whole question: can we handle it this time? And I'm not so sure.
Right. And what type of safety nets can we provide if it does start to become more mainstream, more accessible, and people are having a little bit of psychedelic fallout? How can we catch them?
But it's exciting and very interesting.
It is. It's very exciting. Okay. Anything that you want to close with for today? You said you have a new book coming out. I don't know if you want to pitch it or where people.
It will be a while before you see it in the bookshelf. Okay. It's called "Come to Your Senses." But yeah.
Okay. Awesome. Well, Dr. Bessel van Kolk, thank you so much. Really appreciate it.
Okay. Thank you.